So we'll get started. Thank you so much for being here. We are excited for today's ECHO presentation. We're going to be hearing from Dr. Evan Holloway in just a few moments, talking about coordinating care across settings. Evan, can you go to the next slide? Great. So a couple of announcements. Whoops. Get the screen share going again. Evan, you're muted. Okay, excellent. So a couple of announcements. So we were formerly known as the CAP portal. We are now CalMAP. That stands for California Child and Adolescent Mental Health Access Portal. We're very excited about it. If you visited our website, you'll see we've had a rebrand. We are open for consultation. So if you are seeking more personalized guidance on how to apply today's teaching or other things, please give us a call. You can either call us or request a consultation online on our website. And we also have a monthly webinar series recording service. You can watch recordings of past webinars on your own time and answer questions, and then receive continuing education credit for those. And we also have lots of other educational programming available through our service that are all free. So we invite you to take a look at all of that on our website. Next slide, please. Okay, so disclosures. We don't have financial disclosures, but here's some information about our funding sources. We're grateful to our partners. And next slide, please.
Actually, Lindsay, we don't have a mindfulness slide.
That's okay. Well, so
Okay.
we like to get started with a brief mindfulness activity to allow us to transition out of whatever we're coming from and into this space. So if folks can take a comfortable seat or stand, however you're position yourself now, if you can kind of just settle in, and we'll do just a brief body scan. And so taking a breath or two, bringing yourself into this Wednesday afternoon. I invite you to focus on any sensations in the upper part of your body. So your head, your neck, your shoulders. Those are often places where tension can be held in our muscles. If you're noticing that, you might check in and see if it's possible to let your muscles relax a bit. Scanning down to your arms and elbows and wrists and hands. Again, noticing any areas of tension and seeing if it's possible to let that go. And finally, down to the lower half of your body, to your legs, feet, your ankles. Again, noticing any sensations you can feel, perhaps contact between your body and the floor or your chair, what that feels like. And when you're ready, you can bring your attention back. Thank you all. All right. Well, again, thank you so much for joining us today for our school-based ECHO series. We are really grateful today to have our very own Dr. Evan Holloway speaking to us. Dr. Holloway is an assistant professor in the UCSF Department of Psychiatry and Behavioral Sciences and a licensed clinical psychologist. He's an attending psychologist in the Wavefront Outpatient Cognitive Behavioral Therapy Clinic at UCSF. And he has advanced training in a number of different areas, including pediatric and forensic psychology, mental health, substance use disorders treatment, and services research. He provides clinical supervision through the Multicultural Clinical Training Program at Zuckerberg San Francisco General Hospital and research supervision through the Clinical Psychology Training Program and Juvenile Justice Behavioral Health Lab, also at UCSF. His research focuses on improving behavioral health and legal outcomes for youth and families involved in the legal and foster care systems and service access for publicly insured youth. Thank you so much for speaking with us today, Dr. Holloway. I'll turn it over to you.
Thanks, Dr. Brewitt, and thanks everybody for coming today. I'm really excited to talk about how to break down siloed systems and to sort of consider what might be happening with kids and families we work with outside of the individual. So the learning objectives for today are to be able to identify at least two ecological systems that impact child development and behavior, to define our role as gateway providers. Sometimes people use the term gatekeepers to care, but I think gateway providers is a more like ways to get people into care rather than stopping it. To be able to identify a kid's biological or chosen family and natural supports via diagrams. There's a lot of ways to do this, but I think as a visual person myself, sometimes it's helpful to sketch things out. And then finally, to be able to describe two characteristics of siloed systems and how to overcome them. I'd first like to introduce or perhaps reintroduce the bioecological model from Bronfenbrenner and Morris. And first to bring your attention to the center. I think about this like an onion. At the center is the individual or the kid that you might be working with. And there are several strengths and perhaps vulnerability factors that they may be born with, right? Or may be sort of inherent to who they are. And we know that genetics interact with the environment, right, to influence a lot of outcomes. And as kids, from childbirth, the family has sort of the biggest influence. That's the family microsystem, is sort of the term according to this model, has the biggest influence on their development and behavior. And as kids grow, the family stays really important, but peers become increasingly important through childhood, adolescence, up into our mid-20s and sort of beyond. So this here at the center of the onion, closest to the individual, has a really huge influence on behavior and health behaviors. But we also know that there's a lot of other things that can influence our behavior. And so moving out to different levels of this onion, we'll introduce what we might call the exosystem. So these are things like more environmental characteristics. So like what neighborhood you live in, what social services are available or not available, the influence of local politics, and mass media, the availability sort of jobs for families and things that might have indirect impact on kids. And so introducing this, the exosystem also plays an important role, but there's a little more separate from the individual. And so when we think about how this could impact kids that we might be working with, this could be things like encountering microaggressions or racism, right? Or being exposed to advertisements. I put an example here of some to the right of some advertisements that have been targeted towards kids on social media or that kids have seen in their neighborhoods, for example. So these things can also have an influence on behavior and health behaviors. And so with that, I just want to say that that model and a lot of the research and the sort of predominant theories and practice, a lot of it is based on like a Western perspective. And so these are just helpful frameworks, I think, but it's really important to always consider the individual child and family's culture, what is important to them as a family, as a kid, right? And also to recognize that these things change over time. So just wanted to point that out. But when we're working with kids and adults, but focus here being kids, I want you to think about those systems that I just introduced, what their impact is, both on maybe, why this kid may be coming to your office, but also what's helping them be successful and the natural supports that already exist in their life. So as I said, families have perhaps the largest influence, so we're going to start there. And I think appropriately, there's more and more understanding that family is sort of constructed, right, and chosen. It's not just biological family. And so whenever you're working with a kid, it's important to think about who is in their family. And this is important because those folks are going to have an influence on their behavior and how to support that behavior. So one way to do this is to draw out a family diagram. Again, there's no wrong way to do this. I just think it's a helpful sort of method. This comes from the structural family systems and like Minution, for example. And in that framework, it is known as sort of a genogram, but we're really talking about the same thing. It's a diagram. So who should be involved in this type of diagram and who should be participating in sort of mapping this out? We'll first start with the kid, the student. Consider their caregivers, other siblings who they might take care of or might be in caretaking roles, and other important adults in their lives, like mentors, neighbors, and perhaps teachers. So now I want you to think about yourselves. And right now, perhaps as providers, but also think about when you were a kid growing up. If you went to the hospital, if you went to go see a doctor or to the dentist, things like that, it's probably rare that you set that up on your own as a child, right? And then think about kids and kids who come to your front door. Maybe they're seeking help if they know to come access you in a school-based health center, for example. But broadly, research shows that kids rarely, if ever, access healthcare on their own. And whenever they do, there is usually an adult who supports their help-seeking behavior. And we refer to this person as a gateway provider, someone who plays that role. And often there might be multiple gateway providers in a kid's life. That could include parents, caregivers, teachers, neighbors, maybe for a kid who's on probation, a probation officer, and primary care providers. And so these are folks who know a kid, they're sort of, what they're sort of normally look like and how they are, so you can pay attention if there's any change in their behavior or reason to kind of check in with them and see if there might be something going on. So gateway providers are really, really important. And I give this example of a gateway provider, a potential gateway provider who could be a teacher. So this is someone who would have the knowledge and awareness of an individual student, be familiar with their needs and strengths. They also would have knowledge of sort of how the school system works, management, what it's like to go to school for this student, and the burden on several providers, right, and other teachers within the school. So these are all things that would also influence the student's behavioral health. And so a gateway provider in this instance is someone who would know the student, recognize that maybe they need to check in to see their PCP, or maybe there's a behavioral health thing going on, and then to help support them in accessing that provider. All right. And so I want to just sort of give an example of how you might construct this diagram, starting with the student. So when, and I'm a very visual person, so I always like to sort of imagine with clients that I'm working with who are in front of me, what their day-to-day life looks like, who they're seeing regularly, who's checking in with them, and to sort of imagine. And whenever there's gaps in that sort of that view for me, then that lets me know where I might want to ask some more questions. So in this example, we have a student who has identified, we know they have one caregiver and another who are very involved in their life. Maybe they have a good or a bad relationship, or not much of a relationship with one of their siblings, and another relationship with another sibling. Maybe we don't know much about their relationships, but we know that they're one of three kids. We also might learn in meeting with them that they're really close with a neighbor, right? So maybe this is someone who's going to have a big influence in their life to support them. And so we're like, okay, we're going to put the neighbor on the diagram. The neighbor and the cousin here look really similar, but they're actually different. So we might also learn that the student's really close with their cousin. And so this is someone who they spend a lot of time with. We learn, or maybe the student doesn't tell us this, but we know this kid is also involved in a chess club. So they have a couple of friends who they see regularly. who also might be natural supports or sort of influence their behavior. We might also learn that this student has a best friend, right? And so these are sort of some important other peers, perhaps, that are in their life, and it's important to acknowledge them. All right, so we learned that one of their caregivers' siblings, right, is Uncle, I want to say Uncle Joe. Uncle Joe is the parent of the student's cousin, who they're really close with. We also know that the uncle has a partner, but we don't know much about their uncle's partner. And that maybe that's okay, right? Sometimes you don't need to have like a fully complete diagram, and it can actually be informative if there's some information sort of missing, or we aren't sure who else is a part of this kid's life exactly. But in this example, there could be a situation, right, where let's say this student is spending a lot of time at their cousin's house. And this actually leads to an argument between the student and the caregiver. And the reason is because the caregiver, number two up here, and uncle, they actually don't have the best relationship, right? And so I think this is an example of how a third person, right, or other people outside of this caregiver number two and the student can actually influence the student's behavior and maybe like fighting with one of their caregivers. And so that is sort of an example of what we might call a relationship triangle. So this is a common thing to sort of consider in family therapy. I'm not going to go through all of the details, but whenever there's healthy family functioning, a triangle can arise whenever someone is really like it can be helpful to have a third person to sort of reduce a little bit of anxiety, right, and to remove some stress from a relationship. But over time, whenever there's triangulation, sometimes this can create some problems, actually. All right, so coming back to this example, so let's say the student's been spending a lot of time with their older cousin who has a big influence on them. Like I said, caregiver two and the uncle actually haven't been getting along. And so this has led to an argument, right, with parents. So I pointed out one triangle, but I'm curious if others who want to unmute yourself or put in, better to unmute yourself, but put in the chat if you can't unmute yourself to think about what might be going on here. Is there anybody else that's sort of a part of this student's life that you might want to learn more about or maybe bring into the picture to support this student? Any ideas?
I think maybe the chess club, since they're spending a lot of time there. And this is maybe a positive activity that they could spend more time doing.
Yeah, absolutely. So maybe caregiver, it doesn't want them to spend time with their cousin or something, right? And so to consider making some other recommendations, right? To think about setting something up with one of the chess club members. It's a great idea. So point being, there could be a lot of different triangles here to sort of consider, and an example of why we don't want to just look at this student and maybe why they show up to school in a bad mood, but to sort of think about the other people in their life and how that might be impacting them. I want to broadly introduce this concept of homeostasis. And homeostasis is defined as the tendency toward a relatively stable equilibrium between interdependent elements. And in this case, these are people, the interdependent elements. And so sometimes there can be dynamics that get established in relationships with other people, and those can be healthy. Sometimes they're not healthy. And it's important to recognize, though, whenever you're working to make change with a student that you're working with, maybe within the school where you're working or with other providers, making that change can actually cause sort of chaos and make things feel a little chaotic. So an example of this being, if a child is suspended from school, they may engage so that they leave the school, and then when they come back, there may be a tendency actually to engage in the same behavior when they come to school because they're in the same classroom environment with the same friends. Maybe there's a teacher who is sort of looking for the same behavior from this kid, and that actually is eliciting some of the rule-breaking behavior or whatever it was that got them kicked out of school. So this is also important to consider and thinking about why it's hard to make changes in systems. Okay, so building on this concept of different people in their lives, this is a term we use sort of in research and in practice, right, is that systems are siloed. And that it can include family systems. When I first heard silos, I thought of these. I grew up in the Midwest. So I was like, oh, you mean like, on a farm, right? But you can see here that there are several similar structures that are intentionally sort of separated, right? They're all very close, but they're intentionally set up to be separated. So there is some similarity here where siloed systems, right? And they look more like business people, but ChatGPT was not cooperating. So look kind of like business people, but I wanted to highlight that providers such as yourselves, right? You might be within a silo and it can be hard to collaborate with other providers, like an external behavioral health provider, for example. And this is a problem because this can make it really hard. It's a huge barrier to getting kids and families access to not only things like behavioral health services, but other resources that could be in, like a social determinant of health, for example. So thinking about, let's say you are working, you're working with a student, the example that I gave earlier, you're like, okay, maybe family therapy would be helpful here. This is sort of the process that, and this might be common and simple for a lot of people, but important to kind of go through. So first you want to make sure that you get consent from the student and maybe their family. Now you don't actually need consent, caregiver consent for mental health and substance use treatment. But in this case, if we're referring to family therapy, you would also want to get the parents' consent because they need to be a part of this. After that, you might consider, are there any services in school that could be provided? The regional center is not going to be relevant here, at least from what we know about this kid and family right now. But you would want to consider what type of insurance they have, the severity, right? Is this like, hey, this is kind of serious, but like there's no imminent risk. Not too worried about our safety plan not working, or is this like, if we don't get this family into services, we're worried about the police coming out soon, right? Or maybe somebody getting hurt. So anyways, considering and supporting what type of insurance a student has, the severity level, their age, diagnoses, and also if there's any system involvement. And even here, thinking about system involvement, this would be another sort of different systems, right, where there's some siloization. So thinking about the public insurance sort of landscape, there are a lot of different services that might be appropriate depending on if there's system involvement, if some of these problems are more based in school, right, in the educational setting, and what might be happening. So I just put this out here to sort of show that these are all different types of services, and the way that you access them might depend on what systems this kid is involved in, or at risk of being involved in. And it's very complicated. And I stole these from my colleague Shelley, very helpful. And so this is a different way of sort of thinking about this student and the different systems that they might have access to, might be in need of, but just to show that all of these different dots sort of work separately from each other, right? Maybe they don't, but oftentimes they have different funding streams, they have different mandates. They might have employees who are trained differently, and they might have different availability, different wait lists, different needs. So it can be really complicated to make sure that kids and families are getting the right resources, that they're not being overwhelmed. And because we actually know that whenever there's too many different programs or services in place, they're not prioritized, that actually can make things worse. So I want you to think about, again, it's always good to ask the question of what other systems, what other providers is this kid working with? Maybe they're not working with someone else and they might need to be connected. So that's where you think about your role as a gateway provider, or maybe they're connected with a ton of other services and they actually don't need all of them, right? And so identifying what other services that they're engaged in or might benefit from is really important. So the solution to this, I have an idea as a provider and as a researcher who studies service delivery systems, but I thought I would love to hear from y'all who have experience, navigating, interacting with other providers, other systems, to see what have you done, what's been successful or challenging in working across systems. So I would love for folks to unmute and share your lessons as the experts in the room.
Can I go first?
Please.
I think what I'm struggling more are finding the services in the community, like really trying to make the connections for our students. Our clinic is really impacted and overwhelmed with our own students, and then I have to go outside and try and find within the community who's taking a Medi-Cal student, who is, taking community clinics if they're available. And so it just delays the whole entire process. And in doing so, it adds more to my caseload because then I'm doing constant check-ins with these students. But I find that that's not only for our students, that is also for me, for my family, for everyone in general, where all the medical services providers, there's just more of a delay factor. So I'm not quite sure if that has anything. It almost seems like that is what's happening right now in our medical health systems, that things are just more delayed in timelines. So, but for mental health, it's a little longer. So that's what I'm struggling with.
Thank you for sharing that, Leticia. I bet that is I know that's been a common experience for me whenever I'm trying to figure out a treatment plan or what the appropriate services are. Have you found any examples where you've had more success of making those types of connections?
Well, because I work with specific population, most of our students are now attached to an immigration social worker or care manager. Okay, so I've been partnering with them. I believe they're from the IRC agencies. And so in partnering with them, they are also going into the communities for me to make those connections with others. So that's been a very, very big help. And then, of course, holding collaborations and consultations with our clinics to make sure that, we're servicing our students, properly. But that one actually has been a very successful one for me. And yes, that person is also struggling and trying to find, appointments and so forth for our students, but the partnerships have worked really well.
That's great. And that's what I have found in my work, and what the research shows too, that can be more effective is like figuring out ahead of time, to the extent that we can, other types of providers we might be able to partner with, right? And either establish sort of more formal or informal relationships with them. Research also shows that like having a personal connection with somebody, spending some time with them, and like sharing cell phone numbers, texting, sort of more informal ways of making these referrals can also be helpful. But I think this is one of the biggest challenges we face in this country, and we've known it's a problem for a while. Thank you for sharing that. Any other thoughts or lessons learned of how some ways others have been successful in working across systems?
Hey, I guess just want to validate, it is so incredibly hard to be able to connect. And I think some of the creative workarounds in terms of being able to communicate with people, for example, sometimes I find myself not because it's the optimal way to do it, but because it's hard to find a mutual time to talk. So leaving kind of asynchronous voice messages for a therapist that I'm collaborating with or something like that, that we're just being practical and doing the best that we can, and just acknowledging, that we want to be able to speak, but it's hard to make that schedule sync up. And sometimes getting creative. This is maybe a little bit dated now, but I used to give families like a stamped and addressed envelope back to me that they could share with the teacher so that I could get the rating scales back. Now everything is electronic, but I think if we can get creative in those ways, then we can increase the collaboration and communication.
Love that. Thanks, Petra. I think in hearing that example, you're also empowering the family and letting them take ownership and sort of guiding it, right? And that is a really important thing too when we're working on teams and in systems, is to make sure that the youth and their family, that their voices are centered, and that we empower them to advocate and help advocate for them with permission. It goes back to good old advocacy a lot of times. Thanks for sharing that. Okay, with that, I think I'm gonna end so we can get to the case. But thank you all for your participation and the opportunity to present.
Thank you, Dr. Holloway. That was great.